I'm sitting here with Katy. So Katy is Katy Pitt Allen. We have two Katys in the business, and this is affectionately Katy Spain. But also Katy works in the UK. So explain who you are, how you came to us, and what you do.
Goodness me. So I'm Katy Spain. I am the regional director of the Women's Health Spain, but I'm also a nurse in Exeter. So I've got a foot on both camps.
Good stuff. How are you finding it?
Yeah, I love it.
How different is it to what you thought it would be, or how is it what you imagined it would be? Because the services in Spain are very, very different. They're more, you lead the services in a different way than you would here. How are you finding that?
As in the comparison between Exeter. So I would say that the service that we offer in Spain is very different in terms of it tends to be general healthcare. That I find, I absolutely love it, but the demand is overwhelming.
Wow.
I find sometimes I want to do, I feel like I want to do everything for everyone. And then I've only worked in Exeter for the first day, not yesterday, no, not the day before.
We've lost track, haven't we?
I know, where am I? And oh my gosh, I loved it. Absolutely, it was just fantastic being able to see, all of my patients were super happy. They were very clear what they wanted. It was lovely working somewhere. Obviously the Nuvi in England is very established. And that was really nice to kind of see okay, this is a kind of brilliant beginning to end service.
So just obviously we've done some videos for the Spanish side, but for those people that are clicking on the UK site, what's your skill set? What's your background and passions in terms of nursing?
So I am gynae to my core. Always been gynae, never done anything else, just gynae. I've done some humanitarian nursing at various points, but really gynae. And my passion, women's health, is completely textbook. But I think especially I've gone from working in a very busy teaching hospital where we were kind of providing emergency urgent care, to then working in the community, which I've got to say is a really new experience for me.
Wow.
And kind of I feel like the more I know, the less I know, and the more you are aware of what women need, then I feel like there's just so many massive gaps, and that's now become my passion.
It is, and I think being in private practice, and you probably get this more so because you're the director in Spain, but you are self-directed. You have to be.
Yeah.
But like so, as soon as you open another door, there's another 3 tunnels to go down, and that's the exciting thing. But thankfully, obviously, you being over there, you're still part of the UK team as well, aren't you? So we obviously talk a lot and develop things, and they're sort of two different businesses, but they're not, because women are women wherever you go, really, aren't they? So it is. It's good fun.
It's great fun. I feel very lucky. But open one door, there's another 3 tunnels. Oh my gosh.
Well, we've also, the other thing that we're really quite interested in with you, and obviously the other nurses, to look forward in the next few years as to what we're going to be doing from the charitable perspective, because now COVID's finishing, we're going to be speaking to one of our patients later, so Sarah, who you met today, about how we can reach out to those people that just don't know about us. But you, like you said, you touched on the humanitarian side. Just give us a quick overview of that, because that's quite a good story. I like it.
Thank you. So I was one of 100 nurses and doctors who was deployed to Sierra Leone in the middle of the Ebola pandemic. Epidemic? Pandemic. Don't know anymore. So many pandemics and epidemics happening. But I was in Sierra Leone it was like a 3-month deployment, but for that included training, quarantine, everything.
Wow.
Yeah. That feels like a lifetime away. But, that's, I think my passion has always been equality in healthcare for everyone. And now it's just narrowed, not for everyone. Now just women.
So keep it simple. Brilliant. We were just going to touch, obviously, the reason you're not in Spain today is that we're at the Nuvi Nurses Network event. I know I'm a bit biased, but how are you finding it?
Oh, yeah, really good.
Great,
Really good. What a great bunch of women. What a great bunch of nurses. It's brilliant. Like, I feel I just need to drain everyone's brains into mine. I feel like we've all come here with, everyone's got a different skill set, everyone's got a different knowledge. We all have a combined passion. What a brilliant place to be able to meet and to share experiences, and I've learnt so much already.
And we're hoping, something we did before you joined us is to restart sort of Zoom meetings with patients. You know, we have our Connect meeting once a month just for the nurses, but we did a lot of that in lockdown where, so a couple of the patients did some as well, where there's a bit of a Q&A. So you would talk about a topic of choice or something that you're very passionate or are knowledgeable about. And then we do a bit of a Q&A, and what we've decided to do with that is have that so that if people want to see it on the website, so we've got another dedicated website for that, and then they can read the Q&As, because those conversations can be a bit different.
Yeah.
But it just, what sort of topics would you like to talk about or explore or share?
So I think, menopause is like, I feel like I've gone down the rabbit tunnel of menopause, never to resurface. That's all I think about. But yeah, menopause is a really dominant subject at the moment for globally, but also in my clinic in Spain. So probably menopause.
Okay.
And what else would I like to talk about? Women's health in general. I could go on about that.
Specific.
Yeah, thank
Brilliant. Oh, well, thank you very much.
Thank you.